Hello all, I'm Dr. Gökay Bilgin from Smile Hair Clinic. Today we will see our patient's Jamie's hair transplant results. If you see the pictures before the operation, it seems like he needs hair transplant for only the front. But when we shave hair, you can see that the crown looks a little bit tinier than the other parts of the hair. So it means that the hair here is going into the telogen epithelium phase, which is that your hair becomes finer than the other parts of the scalp. So that means that he really needs a medical treatment and he will benefit from it. So we advised him to use minoxidil and finasteride combined. We extracted around 3,500 grafts for this patient because even if his donor zone looks dense, actually after we shaved we see that it's not so dense, and if we extracted a lot in one session, his donor zone would look worse. Let's jump into the first month mark. Yes, you can see that his transplanted hair is gone mostly, and his hair is a little bit longer in the crown. So you can see the parts that he lost his hair in the crown. But for now, we did not want to implant anything there because we thought that he would benefit from medical treatment. And his donor zone do not look really nice because, as I told you, it was not really dense. So, after like 3 or 4 months, it will look much better. Let's go to the third month. Yes, his hair started to grow, but they are not still creating enough density. And he had some kind of wounds in the front. He had some kind of accident. But still, you don't need to be afraid of the wounds after the first month because your hair roots will be attached to the skin and they will be intact in the skin. Let's go to the 6th month. His wound is completely healed here, and his donor zone looks much better here. His hair started to grow, but in this case, he needs to use his donor zone hair a little bit longer, not at this length, because with a less dense donor zone, it can be really visible that you had a hair transplant. So here, in the 9th month, his hair is really grown well in the front and in the crown. As you can see, we did nothing in the crown, but with the medical treatment after 9 months, his crown looks amazing. So please do not fall into the nightmare stories in the web and use minoxidil and finasteride combined. You can always use the topical finasteride, which side effect risk is much lower than the oral form, so give it a chance. And let's go to the 12th month. Yes, you can see that his hair in the front looks really nice and he has a natural result, and especially his crown looks amazing with the medical treatment, and his donor zone is mostly healed and it looks great too. So for this patient, 1 session was enough, but in the future, if he uses finasteride and minoxidil together, I hope that he will keep there and he will not need a second session. So please keep in touch for the questions in your mind. We will all reply them. Thank you.